and what the effect they're having on American families. Inflation has been out of control for the past 3 years, and it's having a devastating impact on our country and my state of Alabama. You know, we've got to rein in inflation, or we aren't going to have a middle class left in this country. You know, I want to welcome the Chairman's 3 witnesses. Thank you for coming today. Look forward to visiting with you. I'm honored to have been able to invite a brilliant economist and incredible record of public service to today's panel, former World Bank President and senior Trump administration Treasury official David Malpass, and I look forward to introducing David after sharing some brief observations on the inflation crisis. During President Donald Trump's administration, annual inflation averaged 2.1%. Under President Joe Biden, the annual inflation level has skyrocketed to 5.6%, and inflation has hit a 40-year high. Under President Trump, real wages increased by $4,000. Under President Biden, real wages have decreased $4,200. Gasoline under President Trump's pro-American energy policy averaged $2.58 per gallon. Gas under President Biden has averaged nearly $1 a gallon higher at $3.49. Unlike politicians trying to get reelected, the numbers don't lie. Americans of all backgrounds are struggling, and their struggles show in the data. Credit card debt has soared to a near all-time high of over $1 trillion. American families just can't afford to keep up with skyrocketing prices. Overall, prices have increased 20% under President Biden's leadership. Even if inflation normalizes, those are baked-in price increases that aren't going away. Every American has suffered as a result of the inflation crisis. People of color, single moms, and young folks just starting out have had an especially difficult time in this economic environment. For the average American to afford the same lifestyle they have had at the end of President Trump's presidency, they would need an additional $11,400 per year today just to maintain what they had 3 years ago, $11,000. 2/3 of the Americans are currently living paycheck to paycheck. So, who's to blame for the situation we're in? President Joe Biden and a Congress obsessed with spending money our country doesn't have. The Biden administration has successfully pushed for trillions of dollars in irresponsible deficit spending and dumped fuel on the inflation fire sweeping our country. Clinton Treasury Secretary and Obama Chief Economic Advisor Larry Summers called it right when he said in 2021 that the Biden administration's economic agenda was the least responsible microeconomic policy in decades. The good news for the Americans is that it doesn't have to be this way. There's a game plan that can turn the American economy around, and it has worked before. We're desperately in need of supply-side growth along the lines of what President Reagan brought about in the 1980s. By growing the size of the economy and increasing production of goods and services, President Reagan was successful at turning out of control inflation. The key to igniting the supply-side market response was a tax and regulatory agenda that encouraged economic growth by unleashing the power of the free market system and made America the greatest, most prosperous nation in the world. President Trump built on the Reagan playbook in 2017 when his tax cut package and aggressive deregulatory agenda. As a result of President Trump's pro-growth policies, American prosperity reached new heights, and for the first time in history, blue-collar wages rose faster than white-collar wages. Americans of all colors, creeds, and classes thrived. I look forward to hearing the perspectives of all of our witnesses on the economic challenges facing American children and family. I'm hopeful our discussion today can be the start of something meaningful and a change to turn things around. Thank you, Mr. Chairman.
Thank you, Ranking Member Tuberville. I'll start our witness introductions now. I'll start with Ms. Erin Wiggle. Ms. Wiggle lives in Montgomery County, Pennsylvania, in the southeastern corner of our state, with her husband and 11 children, 6 of whom were adopted. Ms. Wiggle will share how rapidly rising costs have impacted her, her business, and her community. Ms. Wiggle, we thank you for testifying today. Our second witness is Mr. Daniel Lee. Mr. Lee is a retired Army veteran who owns a small business in Philadelphia, Farina Pasta and Noodle. Mr. Lee will share how rising costs have impacted his business's growth and will discuss how, quote, junk fees, unquote, imposed on his business impact expansion. Mr. Lee, we thank you for testifying. And our third witness is Dr. Emily Gee. Dr. Gee is the Senior Vice President for Inclusive Growth at American Progress, where she oversees economic policy and health policy. She leads research initiatives and policy development that aim to support equitable economic growth, our topic of focus today. Doctor, we thank you for testifying. And I'll turn now to Ranking Member for his introduction.
Thank you, Mr. Chairman. My witness today helped both President Reagan and President Trump craft their winning supply-side economic growth struggles and strategies. He's one of the best economists out there and respected far and wide. David Malpass most recently served as the 13th president of the World Bank, where he focused on increasing economic growth to reduce global poverty. Just prior to this role, Mr. Malpass was nominated by President Trump and confirmed by the Senate as Undersecretary of the Treasury for International Affairs, where he represented the United States at global meetings such as the G7 and G20. In addition to these positions, he spent years as the chief economics of Wall Street giant Bear Stearns. Mr. Malpass also served as Deputy Assistant Secretary of the Treasury under President Ronald Reagan, Deputy Assistant Secretary of State under President George H.W. Bush, and as Staff Director of the Joint Economic Committee here on Capitol Hill. He earned a bachelor's degree from Colorado College and an MBA from the University of Denver, and he undertook extensive graduate work in economics in Georgetown University. Currently, Mr. Malpass serves as this Distinguished Fellow of International Finance at Purdue University. David joined here today by his wife, Adele, and has a distinguished career on Capitol Hill service herself and now runs the Daily Caller news organization. I'm honored to have David here today as a witness and look forward to his testimony. Thank you, Mr. Chairman.
Thank you, Ranking Member Tuberville. We'll turn first to Ms. Erin Wiggle.
Chairman Casey, Ranking Member Tuberville, and members of the subcommittee, thank you for the opportunity to testify before you today. My name is Erin Wiggle. I currently live in Worcester Township, Pennsylvania, along with my husband and children. I am testifying before you today to share my family's experience with rising costs. First, I want to share a bit about my family. My husband and I are both retired Army veterans, serving together from 1991 till 2010. Today, we own a nonprofit goat and farm animal rescue that grew out of our community's tremendous need for farm animals rescued during the COVID-19 pandemic. In addition to this, my husband and I are proud parents to 11 children from ages 3 to 27, 6 of whom are adopted. After having 5 children of our own, we chose to expand our family through foster care and adoption. Over the course of 12 years in the foster care system, we have cared for an upward of 50 children. Many of these children we have fostered and since adopted have special needs, including Down syndrome, Dandy-Walker syndrome, Tourette's syndrome, and a genetic disorder that is currently unnamed. Between our businesses and our children, we incur many expenses, from diapers and food to gas and vet costs. This is particularly true given the medical needs of some of our children with special needs. Some require special diets, while others require frequent trips to specialists. These costs add up. They have become more burdensome since the pandemic. For example, yogurt used to be $4 for $1. Now they're $1 each. American cheese went from $4.99 to $9.99. I used to be able to buy a bale of hay for under $5. Now they're at least $10. Dairy products have increased tremendously. We have also seen products we use every day, like laundry detergent, shrink, while we're stuck paying the same prices. This means while I used to buy laundry detergent every month, I'm now buying it more frequently. Similarly, paper products have gone up in price as well and shrinking in size. And at one time, I could buy all of our paper products, paper towels, paper plates, toilet paper for the month. Now I find we're needing to restock in 3 weeks' time. Our oldest children are now beginning to live on their own and make financial decisions of their own. Our oldest son has joined the military and is currently stationed in Arizona. 3 of these children have tried to stay local, but have found it's not possible to stay in the area as housing prices are far too high for the typical 20-something. They struggle to afford things like groceries, utilities, and health care, things that my generation took for granted. High costs have impacted every generation of our family. My family and community have wondered why costs have continued to stay high, even continued to rise following the pandemic. My husband works in logistics, so we were very aware and understanding of the supply chain challenges and that the market faced during the pandemic, but they have continued to increase in cost is making no sense. Starting wages have remained the same, yet the price of nearly everything has gone up. The average employee will work for an hour and can still not afford a block of Velveeta cheese. Senator Casey's work on greedflation, exposing large corporations who have continued to increase their prices beyond what is necessary during the pandemic to inflate their own profits, has resonated with my family, from straight price increase to junk fees to what Senator Casey has called shrinkflation. It's not fair to consumers. Companies should be able to make a product and make a profit, but not take advantage of the average family. I want to be able to continue to give my children the life that they deserve and to continue to operate our rescue, but these costs have strained our family, and our companies should be aware of the impact and the actions they have on consumers. Thank you for the opportunity to testify and share my experiences today.
Thank you, Mrs. Wiggle, and we'll turn next to Mr. Lee.
Thank you. Chairman Casey, Ranking Member Tuberville, and members of the subcommittee. Thank you for inviting me to participate in today's hearing, and thank you for your attention on a topic that is of critical importance. My name is Daniel Lee. I own and operate Farina Pasta and Noodle. We are a fast casual restaurant located in Center City, Philadelphia. I am a member or veteran of the Army, where I was doing explosive ordnance disposal work for about 4 or 5 years. I started a fresh pasta-focused restaurant concept in a ghost kitchen in 2020, evolved into a brick-and-mortar location in 2021. I love what I do, and I thrive on the trusting relationships that I've built with my local community. But I'm challenged every day with how to keep my doors open, my staff compensated, and my customers happy and eager to return. Today, I'd like to share a few of these macro challenges with you all. Challenge number 1. The pre-pandemic prices have not come back. As a small business, everything I buy has gone up significantly in price. When prices rose during the pandemic, we accepted the general pricing hikes on everything from produce to packaging, plates, silverware, everything. Those price increases were passed on to small business owners, and however, there is now no longer a shortage of produce and drivers and general things to bring those prices back down. We still see a higher price in gas, and we still see a higher pricing in our packaging. Why haven't we seen these prices come down? As you're likely aware, fast casual corporate chains, many backed by private equity investors, are opening all around me. I'm not afraid of the competition, and I will stand by my products and services, but it's not a level playing field. We don't have the buying power that they do. We can't purchase in bulk. We can't buy tons and tons of packages to reduce our pricing. We don't have the negotiating power. We also don't have the large marketing budgets to bring in the customers that they do. Challenge number 2, the junk service fees. When customers orders delivery from my restaurant, many times they're finding us through some of the third-party delivery apps like Grubhub, DoorDash, Uber Eats. And they charge fees as a part of being on their platform. Sometimes those fees are as high as 30%, plus marketing fees, which can be like sponsoring a post or something like that. All told, that could take as much as 50% from each order. To offset these fees, we charge a higher price on their platforms than what we were charging in in-store. That alienates a lot of our customers. When these delivery apps find out that you have a higher price on their third-party apps versus what you have on an in-store, what they will do is they will throttle your company. So they will basically take your company and move it down in the search rankings. And I have an email from one of these companies saying that they did just that to my company, because I have lower fees, lower prices in my in-store. Most of these small businesses are not easy to find as it is on those third-party apps. Companies like Wendy's, McDonald's, sometimes you'll find them under the local eats section, under Uber Eats. As far as I know, McDonald's is not local anywhere. It's a vicious cycle. We raise our prices to maintain revenue. Higher prices cause me to lose business and lose money, and eventually restaurants like mine shut down. Challenge number 3, employee acquisition and retention gets more and more challenging. Inflation also impacts my labor costs. Employees are struggling with the same inflated cost of groceries, gas, and rent. Currently, I pay a base salary of $14 an hour plus tips, which puts them over $15 an hour. And that's to retain the qualified labor, committed, well-paid employees, which also result in an all-around better customer experience. But as I've experienced, if you cannot pay $14 an hour or $15 an hour in some cases, plus tips, you'll find that your customer service suffers, so customers don't return, and then they'll leave you bad reviews. In conclusion, I'd like to say that I care very much about my business and the small business community and the culture around me. When consumers shop local, 68 cents of each dollar spent is recirculated within the local economy. This ripple effect is powerful and significant to our local economies, and it is also at risk. As small businesses fail, all our neighborhoods lose what makes them unique and vibrant, from the food they serve to the goods they provide and to the cultures and communities that they represent. This isn't just true for Philadelphia, but this is true for all large cities, small towns across the country. As an advocate for these communities, I thank you for listening, and I look forward to help you in moving forward.
Mr. Lee, thank you for your testimony. Dr. Gee?
Good morning, Chairman Casey, Senator Tuberville, and members of the subcommittee. Thank you for inviting me to testify today about the high costs that American families face for everyday expenses and what can be done to improve affordability. I'm an economist and senior vice president for inclusive growth at the Center for American Progress, an independent, nonpartisan policy institute dedicated to improving the lives of all Americans. Today, I want to stress that the trajectory of the economy is not simply the result of an invisible hand of the markets, but the result of deliberate policy choices. Rising corporate power and growing inequality come from decades of overly permissive antitrust policy, labor laws hostile toward workers, and a tax system that lets corporations get away without paying their fair share. This morning, I will discuss some ways in which high costs for basic expenses can undermine families' economic security, the role of corporate concentration in rising prices, and lastly, recommendations for federal policies that have provided families relief and could further restore the balance of power in the economy. First, allow me to note that the state of the overall U.S. economy is strong. In the past 40 months, the United States has added over 15 million jobs. The unemployment rate has held steady at around 4% since late 2021, and inflation is now below 3%. Nevertheless, the global economic shock brought by the COVID-19 recession looms large in our collective memory. It rocked families' financial security, fractured fragile supply chains, and placed small businesses at a disadvantage. The pandemic's unstable economic environment also generated an opening for firms to exercise their market power by hiking prices above cost. Researchers at the Federal Reserve Bank of Kansas City found that markups could account for more than half of 2021 inflation. Higher markups translate into higher profits, and both markups and corporate profits rose in 2021 to their highest levels in 50 years. While inflation has moderated, the high level of prices is still giving Americans sticker shock at the checkout counter and in the grocery aisle. When surveyed, Americans rank the high cost of living and inflation as one of the top concerns facing this country. In particular, childcare and healthcare are two of the biggest costs in families' budgets. Many families spend well above the federal affordability benchmark, that's 7% of annual household income, for licensed childcare, including 95% of low-income working families. And the burden of rising healthcare costs only adds to this financial strain. One contributor toward higher prices throughout the economy is rising consolidation. This is the result of 40 years of policy tilted in favor of large corporations, fueling the growth of private equity at the expense of workers, families, and small businesses. Corporate profits increasingly are concentrated in a declining number of firms. Americans should be concerned about dominant corporations using their increased market power not only to increase prices, but also to limit choice, to conceal information necessary to make informed decisions, to wield greater control over our personal data, and to limit workers' job mobility. By one estimate, the increase in corporate power over the past 20 years costs the average American household $5,000 annually through higher prices and lower wages. Federal policymakers have an opportunity to shape markets to lower costs for American families and empower businesses and small businesses and workers. With everyday costs in mind, I want to highlight 3 areas of policy to address corporate power. First, greater transparency is essential for robust competition. Transparency for consumers, including full information up front about pricing and product characteristics, facilitates comparison shopping and budgeting. It also enables honest firms and efficient firms to distinguish themselves by offering lower costs in the marketplace. Second, if Congress wants to improve competition, it should back that up with funding for expanded authority for antitrust enforcement. The FTC and DOJ are charged with overseeing a growing economy marked by diminished competition, but are not being given the resources to keep up. And third, as we consider the toll of high costs, we should keep in mind the other side of the ledger in family budgets, that is wages. Going forward, policies such as overtime protections, bans on non-compete clauses, and raising the minimum wage are essential to ensuring that workers have a fair shot. In conclusion, the growth of corporate profits stands in contrast to the still shaken confidence that American families have in the economy and the stress that they feel from high prices. To grow the middle class and ensure that families are able to afford the things they need, Congress should take action to ensure that high costs are not a barrier to growing the middle class and for American families. Thank you.
Dr. Gee, thanks very much for your testimony. Mr. Malpass.
Thank you, Chairman Casey and Senator Tuberville and members of the subcommittee. Thank you for the invitation to testify. My remarks today are focused on the cause and impact of high prices. They are continuing to put strain on children and families in the U.S. and around the world. I focus my work as president of the World Bank on higher incomes, clean water, and sufficient energy for people in developing countries. Fast market-based growth, non-inflationary growth, is the critical underpinning of higher living standards. U.S. first quarter real GDP growth was only 1.4%. This is disappointingly slow, especially considering the huge injection of demand through government spending and debt. The non-government portion of the economy is barely growing. The explosion of government debt is costly not only because of debt service, even more costly is the intergenerational transfer that supports the current government and its policies, but uses up future resources. The Congressional Budget Office economic projections show only 2% real growth in 2024 and the same or less in the subsequent 10 years. The generation of Americans coming of age then will be repaying trillions of dollars of debt without having benefited much from it. Reversing the current stagflation will require a complete upheaval in economic policy to allow faster growth, greater private sector investment, more production, a conscious shift in regulation from excessive to effective regulation, much slower growth in government spending, revised Federal Reserve models and tools, and a recovery in education. None of these is forthcoming in the current administration. I'd like to mention education briefly, given the committee's important remit on that. Children in the U.S. suffered a severe setback in learning during COVID, as they did everywhere in the world, with remote learning proving ineffective. Focus on literacy and numeracy is urgently needed if we are to recover some of the ground lost during the school closures and enable the generation that is expected to repay the explosion of government debt underway. High prices are closely related to production shortfalls. In a market system, prices are a response to supply and demand. Complex regulations discourage investment and production, boosting prices and putting key infrastructure such as canals, locks, pipelines, and the electricity grid at risk. Many sectors of energy production are constrained either by existing regulations or the fear of new regulations, such as the attempted ban on liquefied natural gas exports. The regulatory freeze is particularly problematic for U.S. mining and energy production, which are key drivers of economic growth. To compete effectively, the U.S. needs more energy, not less. Production of nuclear power and other non-intermittent sources of electricity need to be accelerated dramatically to add to base load as we work to strengthen and protect the electricity grid. Combined with costly regulations, the explosion in government spending causes inflation. It's hard sometimes to fully comprehend the size of the expansion of government in recent years. I've called it uncharted territory, but that doesn't go far enough. It's truly out of control. Outlays were running roughly $4.2 trillion per year prior to COVID. They jumped to $6.7 trillion in FY20 and 21 and are now expected to be maintained at roughly $7 trillion per year and then rise to $8 trillion later this decade. This sustained surge in spending causes businesses to invest and hire less. It crowds out small businesses. It's the epitome of irresponsible microeconomic policy. CBO's June baseline showed $85 trillion in 10-year outlays in the FY24 to 34, FY25 to FY34 time period, and $63 trillion in revenues. This adds $22 trillion to the national debt. That's the CBO baseline under the current policies of the Biden administration. The rapid escalation of national debt is creating huge problems globally. I've written extensively on this. The U.S. government is materially slowing global growth by absorbing a huge portion of global capital and allocating the funds to government consumption rather than global investment. The short maturities of U.S. debt add materially to that particular problem. Solutions exist. You can change policy. The government can rethink the way it interacts with inflation. The risk under current policies is continuation of the status quo as the economy weakens. That's in the CBO forecast. The economy is digesting years of high real interest rates and a deeply inverted yield curve. That's a scenario that's antithetical to private sector growth. Manufacturing data has been weak. Commercial and industrial loans have been weak. There needs to be greater production of energy, which is critical for sustaining the electricity grid and the growth in electricity that's needed. A supply-side approach based on increased production, would bring inflation down and also allow interest rate cuts while defending the dollar. The Biden administration has argued against such changes. At first, it said inflation would be transitory. That idea was supported by the Federal Reserve, but like so many of the Fed's models, inflation models, it didn't pan out. The administration then blamed the supply chain, it blamed shrinkflation, it blamed corporate greed and Donald Trump. Shrinkflation didn't work because the CPI takes smaller package size into account. The corporate greed complaint wasn't supported by the data. An exhaustive Fed study last month disproved it. Aggregate markups have stayed essentially flat since the start of the recovery. So in conclusion, the election cycle has made clear that there is another path. There's positive change by reducing harmful regulations, taxing much less than President Biden's proposals, encouraging private sector growth, and defending the dollar. Markets are forward-looking, so the benefits would spread quickly through the economy.
Malpass, we just have to-
Prices and
we're way
interest
over now.
rates could decline relatively quickly, helping consumers make a comeback. Thank you, Mr. Chairman.
We're just way over, so I wanted to move on. We'll start with our questions. I'll start with Mrs. Wiggle for my round of questions. I wanted to discuss a few of the products you spoke about in your testimony. You mentioned how now that you're buying paper plates and paper towels and toilet paper every 3 weeks instead of once a month. Is that correct?
Yes.
And these products are shrinking, and yet the price is remaining the same. That, meaning that you and other consumers are paying a higher price per unit for each price. In the report that I issued in January, the shrinkflation report, which was, I guess, the third of my series of reports, I detailed some of the shrinking products. For example, Charmin toilet paper reduced the size of a roll by 7% but continued to charge the same. Gatorade reduced the size of their bottles by 12% without changing the price. So what I found is that shrinkflation is easier for companies to get away with, and the data has shown that consumers are less sensitive to size changes compared to price increases. They often don't notice a slightly smaller bottle of dish soap or a less full bag of chips. This comes in addition to price increases that you've seen across product categories. You flagged both yogurt and cheese in your opening statement. I'd ask you this, how much would you say your grocery bill has gone up per month since the pandemic?
Well, obviously, we have a large grocery bill to start with, but it is easily doubled. Sometimes it's tripled if we're buying fresh fruits and other products like that. But with the paper products and dairies and meats going through the roof, we easily blow through our grocery budget within the first 2 weeks of the month.
So you're seeing a big increase. And when you realize that prices are going up, did you also realize that the product you had come to regularly purchase was being made smaller? The product shrinking, but the price is not shrinking.
Not right away. It took a little bit, probably 2 or 3 months, and me being the mom that I am, saying, where is this stuff going? And asking my kids, are you using this? Are you using that? And kind of bringing the hammer down on everybody, and nothing had changed except for the size of our products.
Well, I think in your testimony, among other things you related to us, I think you said it pretty well, probably better, certainly better than I did. You said high costs have impacted every generation of our family. You also said towards the end, the last full paragraph, quote, companies should be able to make a profit, but not by taking advantage of the average family, unquote. So I think you said it as well as anyone could say it. I wanted to move to Mr. Lee for a question. I wanted to highlight one of your statements from DoorDash, this statement that you provided to us, I guess is an August 22 statement, August 2022. Farina, your small business made nearly $8,500 in sales over DoorDash. However, DoorDash charged you a commission in addition to fees. So you had both a commission and fees. In the statement you provided, the commission is defined as, quote, amount in commission charged per order collected by DoorDash, unquote. Fees are defined as, quote, the sum of all fees associated with services you use on DoorDash, unquote. These descriptions seem, at least to me, vague, and yet DoorDash charge you approximately $2,300, roughly 26% of your sales total. Using a delivery service like DoorDash takes significant revenue away from your business. Can you walk me through the various charges you have incurred from DoorDash and other delivery apps, and how this has changed over time?
Yes. So The first fee that you normally get is just the top line fee that they charge for just using their service. So that could be anywhere from 15%, that could be 25%, or it could go right now as high as 30%. And that's just automatically what they take off for just using their service. Some of the other fees that they have on there are marketing fees. So in order to stay competitive with a lot of the other larger companies, you have to run ads, you have to give out sales, so buy one, get one, $5 off of 20, that sort of type of thing. All of those things we pay for. So a lot of those associated fees that seem, you know, they don't have a name to them because it's just kind of all encompassing of all of their things that they offer for you to sell. But at the end of the day, though, when you do use a lot of those services, you lose money. I mean, if you take 40% off of top-line revenue, and historically 15% is great for profit margin for restaurants, you're in the negative.
Thanks very much. I'm a little bit over time. I'll turn next to the ranking member.
Thank you. Mr. Malpass, can a Trump Reagan-style supply-side economic approach of tax cuts and deregulation ease the current inflation crisis facing our country?
I think the answer is yes. And as we look at regulatory policy, and I addressed this in my remarks, it really matters to the economy how the regulations work and what burdens they put on. What does it cost to comply with the regulations? What do they allow you to do and stop you from doing? One of the examples is this, the natural gas export ban. It changes the world. Do you know what has happened in Europe is it causes them to buy Russian gas under the table, so that the ban on the U.S. export of natural gas helps Russia, and it hurts the job creation in the U.S. On the tax side, the issue, economists think about it as a tax wedge. So if you think of an employer, they employ a worker and pay the worker the gross wages. The worker only receives the net wages. That's the tax wedge. And so as that goes up, then the incentive for the worker is less and the cost, the burden on the employer is more. So the employer employs fewer people. And so as we look out into 2025, really 26, as the Trump tax cuts expire, there's a bigger wedge and that slows down the economy. So you can fix that by thinking about what do you want to do on tax policy that allows incentives, and what do you want to do on regulatory policy to actually permit businesses around the country to produce more.
Talk about the war on fossil fuels. How is that affecting our small businesses and, you know, prices, the rising prices across the country?
In our current system, whether you like it or not, it's the mainstay of how the system operates. It powers the electricity grid, which is so important for manufacturing, for people's homes, and the cost matters a lot. So as you wage a war on fossil fuels, you drive up the prices, and that filters through the whole supply chain. So as we look at it, the U.S. is an energy-rich country, and I think needs to really take advantage of that. We have enough energy in the country stored in the ground and in the nuclear power potential of the country to pay down the national debt, not keep making it larger. So these are key issues for the government to think about, and for the private sector, of course, to be thinking about in whether you want to invest more in the United States, or are you going to go to other parts of the world that are more friendly toward growth in energy supplies. We see it in especially in the electricity projections, with artificial intelligence growing, the internet growing, and the uses for Bitcoin mining, for example, growing. These are all energy intensive, and manufacturing, of course, it's clear the country simply needs a lot more energy and a pathway to get there.
A good friend of mine, Boone Pickens, who I got to know very well through my coaching days out in West Texas, once told me that we had a 300-year supply of natural gas that we knew of, just in this country. We will never run out of it. Do you agree agree with that?
I think the data, remember the U.S., well, I can recount one. It used to be that the U.S. was thinking about importing natural gas, and there were hubs being set up in the Caribbean to offload natural gas brought from the Persian Gulf, because it's so valuable to people in the U.S. to make fertilizer, to make plastic products. And remember, it's much cleaner on electricity than the alternative, which cleaner, lower carbon intensity than oil and coal. And so it's this giant valuable resource for the U.S. Then when new discoveries were made on how to tap into U.S. natural gas, all of a sudden the U.S. became a giant world exporter. So it proves the value of the resources inside the U.S. and also the value from the climate change standpoint of greenhouse gas emission reduction. It's the way the U.S. has been able to lower. One of the things I saw at the World Bank is on the global stage, people keep having conferences, and what they're looking at is how the rest of the world is going to keep increasing its greenhouse gas emissions, and only the U.S. really has been able to control it. That's largely due to the natural gas resource, which is hugely valuable. One other point is the fertilizer cost. When Russia invaded Ukraine, it cut off natural gas supplies, and that really changed the fertilizer industry. So as we're looking at the famines, and the children and families in Africa, they are suffering massively because specifically of the lack of availability of natural gas for making fertilizer. It's the critical input for that. So as the U.S. thinks about what it wants to do specifically on natural gas, just recognize that it's also the raw material for feeding the world's children. That's a giant capability of the United States, and it's one that I talked about a lot internationally.
Thank you.
Thank you very much. I'll turn next to Senator Hassan.
Thank you very much, Mr. Chair, and thanks to you and the ranking member for holding this hearing, and to our witnesses, thank you for being here and for your testimony. Dr. G, I'm going to start with a question to you. More and more Americans are seeing higher medical bills because of unfair fees from hospitals, something that the hospitals call facility fees, which are charged by hospital systems that own a regular doctor's office. For example, I just recently heard from a constituent, Raymond from Concord, New Hampshire, who had a quick office visit with a specialist and then received a bill with a $1,000 fee for using a so-called hospital facility, even though the hospital itself was across town. This happened because his doctor's office was owned by a hospital. So, Doctor, can you talk more about the impact that these unfair costs can have on families, and what can we do to protect families from this kind of unfair healthcare fee?
Absolutely, Senator. Thank you for that question. Healthcare costs are indeed one of the biggest items in family budgets. And it's also an area where we are seeing high inflation and recent increases in high costs. Let me back up for a second first. I think one reason that we are seeing high prices and consolidation in the industry, part of that is because, indeed, when hospitals acquire off-site facilities, whether that's an ambulatory surgery center or a clinic, they can then charge facility fees. They can also get higher rates under the Medicare program because hospitals and even their off-campus properties can receive higher rates than would a non-hospital facility. This incentivizes consolidation in the healthcare sector. We are seeing bigger and bigger healthcare systems dominate markets. The share of physicians working in private practices is now below half, 47%. We're also seeing increasing vertical consolidation throughout healthcare. So things like insurance companies joining with PBMs, the middlemen for prescription drugs. We're seeing more and more ownership of clinics by hospital systems. This is worrying because, first of all, antitrust has historically treated vertical consolidation as pro-competitive, when in fact we're seeing, both from vertical and horizontal competition, increasing prices. It gives patients less choice and raises prices. And it also makes it harder for employees, particularly those who are subject to non-compete agreements, to earn better wages in the medical profession.
Thank you.
So some solutions I would raise include better transparency for patients, being able to, in the limited cases where they can, be able to compare prices and interpret medical bills. We should hold hospital systems, particularly those who are nonprofit, accountable for ensuring that patients understand financial assistance plans. And then some payment policies would include site neutrality in Medicare. So if you can get the same service, if you can have the same service outside the hospital setting, performed at the same price or the same cost with similar health outcomes, then we should not be paying more for that when it occurs at the hospital.
Thank you very much. I appreciate that. And for my colleagues' information, we have a bill on site neutrality working its way through the Senate. You have constituents right now who on a Friday, when their physician's office is independently owned, are paying a couple $100 for a treatment, and on Monday after the hospital buys it, it can go up to $1,000, so or more. So I appreciate that answer very much, and look forward to working with people on both sides of the aisle on this issue. Mrs. Wiggle, good morning. And first of all, I have been informed that in addition to being a mom of a large and thriving family, you're also a veteran. Is that correct?
Correct.
Thank you very much for your service.
Thank you.
In the Inflation Reduction Act, we took on Big Pharma by finally allowing Medicare to negotiate prescription drug prices, which will bring down the cost of prescription drugs for seniors and help drive down medication prices all across the board. As a mother of 11 children, how does the high cost of prescription drugs and other healthcare expenses impact your family?
Healthcare is a hot topic at our house. We have a lot of trips to and from doctors' offices, specialists, and wherever we're getting our medication from. Sometimes our medication isn't available at our local pharmacy, and we have to go get it from another pharmacy. And that's a hassle because I have to call the doctor's office, have the prescription transferred. Medication and healthcare needs to be a top priority, especially for growing families. It's difficult, and even for my adult children, they have to make the choice. Do I get the better healthcare package that costs more, or do I take the lower standard healthcare package and then pay out the nose if something happens?
Right. Well, I appreciate that. I am running out of time. My third question was going to be one to Mrs. Wiggle about the impact of childcare costs. And I will hold because we have another member here, but follow up with you in writing. Thank you.
Thank you, Senator Hassan. Senator Murkowski.
Thank you, Mr. Chair, and to the ranking member, thank you for this conversation this morning. And Senator Hassan, I will follow up on your child care costs because that's a critical one for all of us. But before I do that, I'd like to direct a question to you, Dr. Gee. I am the vice chair of the Senate Indian Affairs Committee, and we have been focused and concerned about the socioeconomic conditions of American Indian, Alaska Natives, Native Hawaiian children and families. When Senator Heidi Heitkamp was here in the Senate, we worked together to form a commission on Native children. And then in May, we were able to have a roundtable discussion on the report that was generated from that commission. Years of work focused on what limited access to education, economic opportunities, healthcare resources, higher rates of poverty, what that means for so many of our indigenous peoples and the children as they're growing up. One of the things that I think we know without even the benefits of a report like that is that unfortunately the median income of American Indian, Alaska Native families is around $48,000. 26% of American Indian, Alaska Native people make less than $500 a week. And so when we think about these high inflationary costs and then that disproportionate socioeconomic impact, can you speak to how the inflationary trend that we are seeing now, really devastating in so many parts of the country, how it impacts the well-being of our Native peoples compared to other demographic groups? Have you done any review or analysis of this?
Thank you for that question, Senator. I can talk about what I do know, which is sort of an appreciation for what you identified as some very deep disparities in both health access as well as health outcomes between the Native population and the U.S. overall. Some of that also overlays with rural health in general, where rural communities tend to live far from an emergency room or far from, say, a obstetrician. Native communities have much higher rates of maternal mortality than the rest of the United States, and I think as we see more entry of private equity and also more consolidation of healthcare systems, we're seeing increasingly rural communities being further from tertiary medical care and being able to access hospital and emergency care. I think a couple places where I'd point out that the United States has been able to lower healthcare costs in the past few years are for those who do not have either access to Medicaid or have access to healthcare through an employer across the United States is the expansion of the enhanced subsidies for marketplace coverage in the Inflation Reduction Act, which on average lowered costs for families enrolled through that type of coverage by $800 per year. There are also subsidies available to low-income Native American populations, tribal members.
So I'm gonna interrupt you there and move to the question that was raised earlier about childcare, because I think we recognize that when it comes to families and their ability to go to work, if there is not affordable childcare, or if there is no childcare whatsoever, it makes it pretty darn hard. We recognize that childcare is one of the two biggest items in a family's budget, with 7% of a family's annual household income going into it. In Alaska, it's much worse than that. Families pay an average of just about $1,000 a month for childcare, which is roughly 16% of the average Alaskan family's annual household income. And then it's not just about the affordability, it is about the availability. 61% of Alaskans live in what is known as a child care desert, and it's not just related to very rural places like Alaska. What I've been trying to focus on are ways that we can develop child care more as a career than just kind of a job until you get, quote, the real job. And we've been working with those in our military community in Alaska to try to identify that. But this is something where I feel pretty strongly that we have to have a better strategy. It has to be a long-term strategy that we need to consider to develop child care as a career, to ensure that we have trained, credible, available, and hopefully affordable child care providers for our kids, so that families can go out and access these jobs. I've not allowed time for a response there, but maybe if the chairman would entertain that, if somebody wants to just speak quickly to child care access.
Sure.
So I'm happy to go. As you mentioned, there are large swaths of the United States that are indeed child care deserts. Roughly 1/2 of all Americans live in a place where that is considered child care desert, meaning that there are fewer than one licensed child care providers available for every 3 children who need child care. So I think there's sort of two main pieces of this I would highlight. Is one is improving the affordability, ensuring that families can do not owe more than the affordability threshold, 7% of their income toward child care. This is crucial not only because it is expensive, but it's also an expense that families face early in their children's life cycle and their own life cycle, when their earnings power is less than it would be later in life. It's also important to look at the workforce side of this, as you said, making sure that these are good jobs. Childcare work is work that supports other work in the economy. Many childcare providers are themselves mothers, and so it's important that childcare workers earn a fair wage, that childcare providers are able to meet the costs of providing that care, as small businesses in particular, and also that people who are in the care workforce receive benefits that we would want Americans to have, including paid leave.
Thank you, Senator Murkowski. I'll turn next to Senator Murray.
Well, Chairman Casey, thank you so much for holding this hearing and really putting a spotlight on how companies are hiding behind inflation as they jack up prices beyond all reason and hide behind junk fees to charge consumers more, and hiding behind those smaller sizes so families get less and pay more. That is why I'm a very proud co-sponsor of your bill, Senator Casey, a Shrinkflation Prevention Act. I think that's really important. You know, when I talk to people back in Washington State at the grocery store, we're all seeing the same thing. Companies shrinking sizes, hoping we won't notice, raising prices well beyond inflation, and hoping we just won't ask them why. So we just can't stand for that. So I really appreciate your leadership on this. One of the things, and Senator Murkowski talked about it, I know others have mentioned it, is essential to this, and I'm glad we're having this conversation about it, is childcare. It is a full-fledged crisis. Providers are really struggling to keep their doors open. Workers are struggling to make ends meet on poverty wages, and parents are struggling everywhere to find any quality, affordable options that work for their families. Certainly, as Senator Murkowski talked about, having providers is absolutely essential. But I think one of the things we have to recognize is that corporate greed is actually adding fuel to this fire, making it harder for child care providers to stay in business and harder for families to fit child care in their budget. When you can't get affordable child care, you can't work. It's that simple, and we can't work. That makes your family budget even tighter, and it hurts our whole entire economy. So I really believe we have to take very bold action to save our nation's child care system and all the families who really depend on it. That's actually why I wrote the Childcare for Working Families Act, and I'm going to keep pressing on it, because what my bill does for working parents is that the typical family in America would pay about $10 per day for child care. No working family would pay more than 7% of their income on child care. That would make a huge change for parents across the country. This is such a huge cost to families, and it's one we can absolutely bring to this conversation and need to have at this conversation. And it's how we build a fair economy that works for families, where child care is affordable and companies don't profiteer off inflation, and wealthy pay their fair share. And that's I think, what all of us are working to move towards. Let me go right to child care. In my home state of Washington, couples pay, on average, 15% of their income on child care. Single parents pay almost 30%. Programs like Child Care and Development Block Grant and Head Start are really a lifeline for working parents. And it's why I was very proud in the last appropriations bill to secure $1 billion increase for child care initiatives. But as I said, the Child Care for Working Families focuses on all of it, and one of the things we do is a 7% cap on the cost of child care. Dr. Gee, can you comment on what that would mean for families?
A cap on the cost of child care is crucial to making it affordable for families. To expand on what I said earlier, I think one of the problems with the cost of child care is that, unlike other major purchases in life, higher ed tuition, home mortgages, car payments, there's no good option for financing that upfront cost of childcare. Just to underscore how childcare costs relative to other things folks might encounter in life, in 32 states and here in Washington, D.C., the cost of childcare exceeds in-state college tuition. This is also a cost that is actually decreasing over a child's life. The most labor-intensive period of childcare is for infants and toddlers, but that coincides, that's the opposite of the trajectory of parental earnings that we would expect to see, where people tend to get promoted and earn more over their lifetimes, which means that families are facing a very high cost early in that life cycle. So I think that this is a classic example of where markets are going to fail us, because we can't expect families to invest in their children and in the economy without some support and some ability to smooth those costs over the life cycle. I would also say that investing in child care is important for the economy overall. It enables parents, particularly women, to participate in the labor force, which is important for families' overall economic security and for employers being able to hire the workers they need.
Thank you. And Mrs. Wiggle, I see by your resume that you are the mom of 11 children. Talk to us about what child care means to you.
So childcare for us is not an option. I have to stay home with the children while my husband goes out and work. And on the flip side of things, being a foster parent, you can see the divide of parents that are able to work. You either qualify for benefits for childcare or you don't. And if you don't, you struggle for the rest of that child's life until they get to school. And if you're lucky enough to be in a public school that will have affordable before care and after care, it's just not even an option for most families, including my family, which I would consider us upper middle class, and it's not an option. It's just not even obtainable.
Well, Mr. Chairman, I know you feel strongly about this as too. We have to deal with this issue, so I appreciate it. Thank you.
Thank you, Senator Murray. Well, we'll do a second round of questions starting now. We may have other members that come in for their first round, but I wanted to start with Dr. Gee. As you know, for most Americans, the inflation our country has experienced, especially in the period 20 to 2022, was a terribly difficult time for families. These families had to make really horrifically challenging choices as costs for their favorite holiday foods or child's diapers or gasoline rose even higher. At the same time, big corporations weren't facing the same difficult choices. On page 2 of your testimony, you say, and I'm quoting, "Corporations raise prices for consumer goods beyond levels justified by present costs. In other words, increase their markups. Markups were also a major contributor to inflation," unquote. So while families' costs rose, corporations just hiked prices up and were raking in record profits. Doctor, what are some of the tactics corporations have used to squeeze American families and American workers?
Thank you for that question, Mr. Chairman. I'll highlight a few ways that corporations are squeezing workers. One is junk fees, as we've been talking about previously. Mr. Lee mentioned the food delivery apps and the way they stack prices for service fees on top of the posted price for food. Another is in the banking sector. We see fees that consumers might not notice in the reams and reams of fine print that they get for overdraft fees, for late fees, and the Consumer Financial Protection Bureau is working on capping those so that consumers don't face unexpectedly high costs. Another is airline fees, which I know the Department of Transportation is working on. Families may face fees for being able to sit with their children, which adds to vacation costs and travel costs to visit family. These are all things that make it hard for consumers to compare prices up front and therefore make competition difficult. Another is one that you are tackling in your Shrinkflation Act, which was that companies can erode consumer value by not only raising prices for the same product, but also by shrinking your product size, say offering a smaller volume of soda or a smaller package of crackers for the same price. And I think this is worrying not because only it makes it harder for families to afford what they need, but it also makes it harder for families to budget for the future. A survey by the U.S. Census shows that people find these recent price changes stressful. In terms of workers, one thing I would highlight is non-compete clauses is a way that corporations exercise their power. These are contract clauses that prevent a worker from moving to a competitor. And what it does in effect is locks people into their job. It prevents a worker from, say, going to a job where they might have better benefits, might have higher wages, and helps suppress wages. And this is particularly worrying in rural areas where there are not a lot of choices of employers. We see this often happening in the healthcare sector where, say, a nurse or a physician assistant has to sign a clause that promises they will not work for a competitor. And in order to find a job, that person may need to leave town, thus reducing the supply of providers in order to find a new job.
Thanks very much. I'll turn next to Mr. Lee. We heard in your testimony, price increases in recent years have strained your restaurant. And you said that your challenge each day to keep your doors open, to compensate your staff, and to satisfy your customers. You've had challenges kind of making ends meet. In order to keep your restaurant afloat and maintain some profit margin, you've had to take steps to increase revenue. This looks very different for each business. We know that just as corporate price increases have affected you, changes in the local economy constrain consumers. So here's the first question. How have you responded to both price increases on your supplies and your materials?
So what we tend to do is we try to take a step back and look at what we're serving. If there's a way for us to source our products differently from somewhere else, unfortunately, sometimes it does mean that you have to cut back on the portion size or whatever you serve. But a lot of times it's trying to find a different vendor.
And you've noticed, has this had an effect on your patrons, or how do you assess their
Absolutely.
reaction?
A lot of them get very upset when their portion sizes are shrunk or when the prices are increased, and they tend not to return. And then they also tend to leave bad reviews on sites like Google and Yelp and things like that.
I'm a little over, and I don't know if we have any other members that are on their way. The answer is no. Okay. I'll conclude my questions here, but to the ranking member, any questions you have? Yeah, I got it. Okay. Thanks very much.
Thank you, Mr. Lee. Ms. Wiggle, thank you for your service, by the way. Mr. Lee, you lost your mind when you went in the restaurant business. I did that while I was coaching. I thought coaching was hard. My gosh, restaurant business is really rough and getting worse. Just a little information. It's going to be harder and harder for food in this country. I'm on the Ag Committee. Last 3 years, we've lost 150,000 farms in this country, and we've lost 25,000 farmers. Regulations, food costs are going to be enormous. It's going to get worse, not going to get better. Mr. Malpass, first quarter growth under the Biden administration was a pitiful 1.4%. As Congress thinks about tax reform next year, which we will have, tax reform after the election, what's the most effective tax cut to get growth moving in the right direction? And why don't we give cuts to people who have kids for childcare? I'm all for that. What's your thoughts on that?
Thank you, Senator. Across the economy, people are always looking to have their tax rate lower. That's the old adage of tax the guy behind the tree. Don't tax me. Don't tax the guy behind the tree. And so I want my taxes lower. So as you think about childcare, there needs to be considerations of that, and that's part of, I think, the public debate. For me, economics is pretty clear that one function of a tax system is to raise revenue for the government, but to do it in a way that's less distortive. And so that comes back to this idea of a low rate on a broad base. So try to have taxation not be specified, not be narrowed down to certain groups, because it distorts the activity that you end up having on that. So as we look into 2026, you want to have a tax structure that allows small businesses to invest, for example, and that's one of the ideas behind expensing for small businesses of equipment, so that they do buy the new machine that will make their workers more productive, and that way they pay the workers more. And so that's an idea. I think also very important is simply on the income tax side that the brackets stay where they are and the rates stay where they are. That's an extension, and it looks to me like President Biden has included that in his budget proposal for workers below a certain level to keep the rates, knowing that actually affects their livelihoods, their incentives to work. So as we look historically, the best way to have your tax system is to try to keep away to keep the rates down on as broad a base as you can. One example of that, if I can turn to international, is foreign countries struggling with the value-added tax. We saw over the last month this catastrophe in Kenya, where people were actually killed over the proposal of the government to raise taxes. And it goes to this core that when you raise the tax rate to a certain level, people simply won't and can't pay that tax rate. And that was the core of the uprising that occurred in Kenya. The government, I think, correctly decided to pull back from that. It was an IMF-inspired high tax rate regime meant to pay off creditors. So you were having the government take money from poor people to pay to creditors. So they backed off on that, which I was pleased to see. But you ended up with people dead because of this tax policy that was being put in.
I've only got about a minute left here. Just one more question, you, Mr. Malp. You mentioned defending the dollar. What would be the consequences of us losing the dollar, world currency?
We're already seeing some of that. The U.S. doesn't say enough about the importance of the dollar. You don't hear that from the administration, and of it being and the dollar being the mainstay of the world system. So China looks at that and looks to create its own central bank digital currency. So what I mean by defending the dollar is simply having it be stated by the Treasury Department, by the Federal Reserve as they're considering what to do with their policies, that a core part of the U.S. success is having the dollar be a currency that is used around the world and that keeps its value over time. If you lose that, you end up with inflation, for one, which is harmful to children and families, but you also lose the desire to invest into that country. So the U.S. is in an okay position right now because we're chewing through the worst part of this inflation surge. It's devastating, as we've been discussing. But I think there'll be an opportunity in 2025 and 26. If you can increase the production in the economy, the inflation will come down, and then interest rates can fall in the context of defending the dollar.
Thank you.
Thank you, Ranking Member Tuberville. Just now that the tax debate for next year has been raised, I want to ask Dr. Gee, what's your assessment of extending all of the tax provisions for both individuals and corporations going forward?
So, Mr. Chairman, I think some of the points that Dr. Malpass just raised about tax cuts were similar to things that we heard ahead of the Tax Cuts and Jobs Act's passage in 2017. Major provisions of that tax law expire at the end of next year, 2025. And I think it's important that we reassess what those claims were at the time, and because many of them have not come to pass. For example, the tax changes in that law were overwhelmingly skewed toward the wealthy. And so extending those tax cuts would not go very far to helping. I think that those tax cuts could better be used as revenue to support things like childcare, to support lower healthcare costs. And one thing that would be more helpful to American families would be to extend the child tax credit. We saw from the American Rescue Plan Act's enhancement of the child tax credit, including its full refundability, that is an incredibly powerful tool to reducing child poverty. In fact, it cut child poverty in half. The TCJA's corporate tax cuts failed to trickle down to ordinary workers. We did see that an increase in compensation for workers in the top 10% by income, but within firms, we didn't see an increase for the bottom 90%. We also did not see the level of corporate investment that many predicted. Studies show that corporate investment may have even slowed, or at least wasn't as high as expected. And these tax cuts also have not paid for themselves. They're responsible for a large part of the growth of deficits over the past decade.
Well, thanks very much. I know we a little bit over time. I just wanted to thank everyone. I'll do a closing statement and turn to the ranking member. But I want to start by thanking our witnesses for being here today, Mrs. Wiggle, Mr. Lee, Dr. Gee, and Mr. Malpass, for taking the time to be with us, for your testimony and your insights that we all benefit from. As we heard from both Aaron Wiggle and Dan Lee, every dollar adds up when you're managing a family budget or the budget of a small business. A smaller package of paper plates on top of a higher-priced yogurt can eat into a family's budget. A fee imposed on a restaurant by a delivery service that they are forced to rely upon hurts not only the business owner but also the local economy. Dr. Gee painted a bigger picture for us, demonstrating just how the economy had been shaped by the actions of and the interests of corporations, whether it's through industry collusion, market concentration, price increases, junk fees, shrinkflation, greedflation, or the like. We've seen it play out. In the last few months, this, I believe at least, has backfired on a lot of corporations. They've become desperate to cover themselves and get consumers back into their stores. So guess what? They're lowering prices a little bit. I welcome these moves, we all should, but these actions make clear that prices, in fact, were artificially inflated. And we'll see what happens the next time they have an opening to jack up prices. It's now evident that corporations saw the pandemic and related economic shocks as an opportunity, an opening, not to support Americans with reasonable price increases, but to bolster their profits and keep their prices very high. That meant that corporate profits rose in that period, July of 20 to July of 22, 5 times faster than inflation. At this moment in time, corporations feel they have a right to take advantage of a crisis and gouge Americans out of their paychecks. As the CEO of Coca-Cola said, the company felt it had, quote, earned the right, unquote, to push price hikes. While corporations, just like small businesses, should be able to make a profit, they should not be able to make a profit at the expense and on the backs of struggling American families. As Aaron Wiggle said, quote, companies should be able to make a profit, but not by taking advantage of the average family, unquote. So certainly, they should not be able to take advantage through deceptive practices. Congress can and should take action to hold corporations accountable and fight back against greedflation when corporations jack up their prices way beyond their costs. So I look forward to working with my colleagues to make this happen, to pass my price gouging bill and my shrinkflation bill. I'll now turn to the ranking member for his closing remarks.
Yeah, just quick. I went July the 4th from cooking steak to chicken this year, as a lot of people did, because it's a lot less price. American people are suffering. Our country's in trouble when it comes to inflation. It all starts with the common folks, people that actually raise the food or actually run the businesses. Small businesses is in trouble. In my state of Alabama, we are struggling big time with the cost of everything. And it starts with fuel, the input cost for farmers, input costs for truckers. The fuel cost of hauling something is almost tripled in cost. And inflation is not going to go down unless we get back to depending on our fuel and our oil and gas in this country. It's not going to happen. We can trick ourselves. It's just not going to happen. But regulation, regulation, regulation. That's all you have to know. Every time I go to a farmer, to a small business, the regulations put on from city to state to county, all the way to federal. It's unbelievable. We need to let people live and make a living. We need to let people do what they need to do to help our country become stronger and stronger. And until we lift these regulations, until we get the federal government out of people's lives, we're not going to have the same country that most of us had a chance to grow up in. So inflation is growing, and it's not going to go anywhere. And I hate it for the American people, and I just hope the people up here in Capitol Hill will get out of the dang way and let people live, put more money back in their pockets so they can take care of their families, and that's all they want. Thank you, Mr. Chairman.
Thank you, Ranking Member Tuberville. We'll conclude now, but I did want to again reiterate our thanks to our witnesses for being here. I know it's not easy to travel to Capitol Hill to give testimony and to be here, but we're grateful. And if any senators have additional questions for the record, or I should say questions for witnesses or the hearing record, the record will be kept open until July 23rd. Thank you all for participating today. We're adjourned.